let's continue our classes. Reading. Okay, in the wildlife. Okay, 10 wildlife population survey conducted by the Gujarat Forest Department has found as 26.14% of 6,080 in 2022, 7,670 in 2024 increased population of Indian wildlife. Okay, in the wildlife Equus harmonious school. Okay, that is the scientific name of Indian wildlife. Covered one of the 5 subsidiaries species. The Asiatic wildlife referred to as Kurkuk habitat arid zone of West Northwest and Indian subcontinent presently on the restricted to the Lake Ranaka Cheraki in Gujarat. Behavior characteristics solitary shy present in low densities across the distribution range. Horns found only in adult males okay, for browsing prefer nutrient rich forage. Okay, conversations at the IUCN list of threat near threat wildlife protection act 1970 schedule 1. Okay, sites appendix 1. Nile Basin, a recently agreement on the equitable use of water resources from the Nile River Basin has come into force despite the notable opposition of Egypt. Over Nile Basin, the Nile is world's longest river and has a drainage area of the nearly 10% of the landmass of the African continent. Okay, runs through 11 countries from the north to south. South to north. Two main tributaries, the White Nile, originated from Burundi and Rwanda, and Blue Nile, originating in Ethiopia. Okay, other tributaries, Sobat River, Albata River, and Bahre El Ghazal, etc. Volcanic eruption and ionospheric disturbances. Okay, a recent study by the Institute of Geomagnetism establishes the role of volcanism in shaping space weather. Okay, findings of the study ionosphere disturbance. Volcanic eruption produced strong atmospheric gravity waves, triggering the formation of equatorial plasma bubbles. EPBs. EPBs normally observed in the equatorial ionosphere are depletions of in ionospheric plasma density formed during the post-sunset hours. Impact satellite communication and navigation systems generated EPBs can impact satellite communication and satellite-based technology. Volcanism and its mechanism. Volcanism is an opening in Earth's crust through which lava, ash, and gases are triggering. Recent incidents include Mount Ruang, Ivanhoe 2024, Wakari, White Island of New Zealand 2024, etc. Positive effects of volcanic activities. Short periods of cooling. Earth's atmosphere practices particles from volcanoes can cause temporary cooling by sharing income solar radiation. The source of geothermal energy can provide a free electricity for locals. Okay. Improvement in the soil fertility by ejected volcanic ash. Provides mining, which is as magma brings valuable minerals to the surface. Others tourism potential rich ash acts as soil fertilizers, etc. Negative consequence of volcanic activity impacts on climate with the release of dust, ash, and other gases into the atmosphere. Lead to disaster such as tsunami, example Tonga eruption in 2022, that leads to damage of lives, property, habitat, and landscape. Okay, Librega Pass, first batch of pilgrims viewed Mount Kailash aboard of Lord Shiva from all Librega Pass. Previously, pilgrims had to travel to Tibet Autonomous Region to with peak of above Librega Pass, occasion international mountain pass above Kalapeni Valley, forming a triangle between India, Nepal, and TAR China. Situated in Vyas Valley, a photograph district of Uttarakhand, inhabited by the Vithya people of significance as trade and pilgrimage road closed in 1962 by India fearing Chinese incursions and was reopened in 2020. Okay, next we have the social issues, mental health dynamics, and also why there is recently WHO and UNICEF released the mental health of children and young people service guidance report on occasion of World Mental Health. Okay, 10th October. Okay, more than according to the report, 1/3 of the mental health conditions emerge before the age of 14 and half before the age of 18. As estimated, 50% of adults in age 10 to 19 years experience mental health conditions with anxiety, depression, and behavior disorders being the most common. Okay, suicide with the fourth leading cause of death among these aged 50 to 90 boys. Mental health. According to WHO, it refers to a state of well-being in which which every individual realizes his or her potential can cope with the normal stress of life, can work productively and truthfully, and is able to make a contribution to her honest environment. Okay, impact of untreated mental health issues. Untreated mental health conditions can have lifelong consequences impacting academic performance, relationship, and future employment, and sometimes leading to serve outcomes like disturbance, substance abuse, or suicide. Okay, determinants of mental health conditions among adolescents. Okay, immediate triggers or persevering factors among adolescents. These include financial loss, sudden grief, mental health deterioration, adverse life events such as failing exams or public evaluation exams, suicides in IITs and at Koda coaching classes. Influence on social media. Okay, 2018 British study titled social media used to decrease disrupted and delayed sleep, which is associated with depression, memory loss, and poor academic performance. Okay, next we have the cyberbullying and bullying victimization associated with depressive symptoms, suicidal ideation and suicide, social isolation and loneliness, dysfunctional family dynamics, hormonal changes, substance abuse, and issues of gender identity during teenage years. Okay, disposing biological factors, genetic predisposition, such as alterations in gene expressions and family history of suicide, can increase suicide risk by affecting brain functions and behavior. Okay, gender difference, okay, especially girls and young people with poor social support experience mental health problems more frequently than boys and those with a strong social problem. Barriers to accessing mental health services to adolescents, stigma and discrimination, societal stigma can discourage young people and families from seeking a lack of inclusive services. Mental health services often overlook specific groups like children with neurodevelopmental or mental disorders, disabilities, etc. Poor coordination across services, issues in continuously of care, especially during a transition between services for children, adolescents, and adults. A shortage of mental health professionals only 0.75 psychiatrists or lack populations in India. Economic Survey 2024 geographical disparities in infrastructure resources, rural and remote areas often lack necessary infrastructure. Okay, certain personality traits like impulsivity, okay, along with the disabilities and major physical illness, may also elevate risk by contributing to feelings of isolation, stress, and depression. Okay, in the initiatives for mental well-being among adolescents, Mental Health Care Act 2017 to protect and promote rights of individuals with mental illness and ensures access to mental health care and treatment. Telemanage it offers 25 by 7 telemental services including counseling, psychotherapy, and referrals in multiple languages. One of the Minister of Education launched as initiative to provide psychological support to students, teachers, and families during COVID-19 Sati program. The Central Board of Secondary Education CBSE has introduced the Sati program to support mental health among students through workshops, online sessions, global initiatives for mental health well-being among adolescents. Helping adolescents thrive. HED initiatives is a joint WHO UNICEF effort to strengthen policies and programs for mental health of adolescents. Mental Health Gap Actions Program MHGAP launched by WHO in 2008 to fill wide gap between the resources available and needed to address a large burden of mental disorders globally. Global Coalition for Youth Mental Health UNICEF Ecology 2022 to address increasing mental health conditions in youth through public investments globally. Only 2.1% of the government health expenditure is allocated to mental health. Okay, an example of step care of child and adolescent mental health. Okay, example family and community support and self-care. Example community-based support delivered by non-specialist workers in accessible communities locations such as primary health care clinics and schools. Example psychological intervention delivered by the specialist or non specialist workers in primary healthcare schools or community mental health centers or teams. Example inpatient or outpatient services and crisis intervention delivered by the specialist workers in general hospital and specialist integrating mental health into the primary health care. It can boost mental health care promotion and prevention, yearly detection and care of common mental health conditions in adults. Trained community of psychiatric nurses in Nigeria provides outpatient mental health services in primary healthcare clinics supported by the community health care workers. Designing community-based mental health services and work of services mental health care should be integrated within the general health services. Example primary care complemented by community specific centers and supported by the service outside health sector such as schools and youth centers. Early interventions for specific mental health conditions that emerge in adolescence and early adulthood to prompt directions and evidence-based care is essential. Example psychosis, eating disorders, etc. Schizophrenia Research Foundation in Chennai provides early intervention with the first phase of psychosis. These intervention technologies can be used to deliver or support mental health interventions. Example WHO chatbots based sustainable technology for adolescents and youth to reduce stress. STRAS. Child marriage in the Supreme Court is a petition filed by the Society for Enlightenment and Voluntary Action issued a comprehensive guidelines for prohibition of child marriage. Stats of child marriage in the NFS is 23.3% of the women aged 24 years were married before age 18 years. 70.7% of men aged 25 to 29 years were married before age of 21 years. Next we have the prevalence of child marriage has reduced by half from 47% to 2006 to 23.3% in 2019 to 2021. Andhra Pradesh, Assam, Bihar, Jharkhand, Rajasthan, Telangana, Tripura, and West Bengal have higher prevalence of child marriage than national average. As per NCRB, number of cases registered under the Prohibition of Child Marriage Act 2006 during the last 5 years have increased from 385 2017 to 1050 reasons for prevalence of child marriage in India. Poverty and resource society. Families marry off daughters early to reduce financial burdens, particularly dowries and new view girls as economic liabilities. Deep rooted cultural and traditional values in conservative service. Child marriage is seen as way to preserve family honor. Ensure virginity and protect girls from the pre-marriage sexual relationship or traditional religious and transgender customs and social acceptance of child marriage is the predominant reasons for the prevalence of child marriage. Patriarchy and gender inequality. Girls are seen as a burden of their family and marry one's daughter at a young age is viewed as a way to ease economic hardships by transferring this burden to her husband's family. Low value placed on girls' education. Girls are not seen as being worthy of investment in education. Poor educational proportion limits poverty of child to resist marriage as alternative aspirations get diminished. Fear of safety and security. Many parents feel that it is best interest of girl child to marry early to ensure her safety, where girls are higher risk of harassment and physical or sexual assault. Legal enforcement has weak law enforcement, lack of awareness and inadequate monitoring, especially in the rural and remote areas, leads to the continuation of violence of child marriage. Example convictions and reporting of child marriage cases are extremely low. Consequences of child marriage. Physical early marriage can lead to forced sexual activity and export to domestic violence. Development can result in low education and life skills, increasing vulnerability to abuse and poor health. Okay, human rights violations, child marriage violates the right to a free and joyful childhood, education, development, etc. Okay, health, early and repeated pregnancies damages the productive health for girls. Example: 6.8% is the one age 15 to 19 years where already mothers are pregnant at the time of the survey, and FHS 5. Psychological burden of the family as wife and mother in on child impacts their psychological well-being. Okay, global impact, child marriage is included in goal for achieve gender equality and empower all women and girls. Okay, measures taken by the government. Enactment by the Provision of Child Marriage Act (PCMA) 2006 prohibits marriage of girls under the 18 and boys under the section 21, section 16 out of the Act authorizes state governments upon child marriage prohibition office CMP. Okay, the Juvenile Justice Care and Protection of Children Act 2015 has provisions for care and protection of children who are imminent risk of marriage before attaining the age of marriage. Okay, Beti Bachao, Beti Badhao scheme 2015 implemented by the Minister of Women and Child Development. It aims to break gender stereotypes and challenges on central cultures in cooperatives in components of celebrations of birth of girls child. Okay, linking Suganya some of the accounts with the birth of girl child and preventing child marriage. Okay, National Commission for Protection of Child Rights. You can see RPR. Okay, it undertakes various activities with the stakeholders such as representation of child welfare committees, CWC, okay, police, women and child development department, and civil society organizations on issue of child marriage. Okay, National Action Plan to Prevent Child Marriage. This is a comprehensive framework which aims to providing support to girls which are at risk of early marriage. It includes better direct collection, awareness programs, and stronger coordination between state and local governments. Emergency outreach services. The Government of India has introduced a child line with a short code 1099 24/7 telephone emergency outreach service for children in crisis, including for prevention of child marriage. A partnership of state governments with UNICEF and other NGOs. Okay, example: UNICEF in Bihar is building capacity of local faith-based leaders and Kathawachak on child marriage and creating a fleet of UH area okay, to act as a door ascendant to the village level. For Supreme Court has issued a comprehensive guidelines to prevent child marriage in India, covering various components: legal enforcement, involvement, and accountability of CMPO by state governments and union territories duties at the state district level. These officers should not be burdened with additional duties that could impede their focus on preventing child marriage. District level responsibility for prevention of child marriage to collectors and superintendent of police. Okay, establishment of special police unit and special unity by marriage prohibition unit. Judicial measures empowering magistrate to take more action to prevent solemnization of child marriage, explosion or special task fast task force for child marriage crisis. Okay, mandatory action against child neglect for public servants, community involvement, aversion of child marriage free village initiative, and child marriage free certifications for religious and gram majors on the lines of common defection free, which is under such part of awareness campaigns and capacity building of racial sexuality and right education by integrating it into the school curriculum. Okay, training for recommended health workers, education, law enforcement, and judicial officers, use of technology, establishment of a centralized reporting portal for child marriage by Minister of Home Affairs, Minister of Women and Child Development, and also leveraging technology for support services by states and UDs to disseminate information against child marriage across all media, focus on high risk region, data analytics to identify high risk areas and parents for swift intervention, finding resources, clear annual budget allocation for each state, specifically aims at preventing child marriage, institutionalization of juvenile justice fund established under section 105 of the Juvenile Justice Act. Okay, Global Hunger Index. Why there is Global Hunger Index 2004 has been released by concerns worldwide and World Hunger Nile Government Organization from Ireland and Germany respectively. Key findings of the GHA. Global findings hunger levels in 42 countries are at alarming levels, making a goal of zero hunger by 2030 attainable at the pace of progress world may not even attain a low hunger level unit until the 2016 year. World GHA score is 18.3, which is considered moderate. The severity of hunger scale report highlights link between the gender inequality, climate change, and hunger. Gender is intertwined with the climate and food security challenges in a way that respective policies and intervention often ignore. Women and girls are typically hardest hit by food security and malnutrition. They also suffer disproportionately from the effects of weather extremes and climate emergency. India relocates findings. They are ranked 150, 105 out of the 127th countries up to from in 2003, falling under the serious category with 41 other nations including Pakistan and Afghanistan. Okay, India's GHI score is 37.3. India's GHI score has fallen since 2000. However, child wasting and standing remains very high. Okay, child undernutrition in India goes hand in hand with the poor nutritional status of mothers, underscoring need for attention to maternal health and nutrition. However, according to the experts, global hunger index continues to be an erroneous measures of hunger with serious methodological issues and shows a magnified intent. Some of the issues highlighted by the experts are key issues of the GHI methodology. 3 out of 4 indicators used for calculations of index are related to health of children and cannot be representative of entire population. Child standing, wasting, and other 5 mortality are outcomes of the complex interactions of various other factors like drinking, character, sanitation, genetics, environment, and utilization of food intake apart from hunger. Faulty indicator studies challenges use of standing as indicator of undernutrition, showing it occurs in well-nourished populations as well. Outdated set source of data used to construct global hunger index outdated and far from convincing. For example, the National Family Health Survey data on standing, wasting, and other 5 years children are not available annually but every 8 to 10 years. A small sample size indicator of proportion of the undernourished POU population is based on an opinion poll conducted on a very small sample size. Okay, the report lowers India's rank based on the estimate of the POU population for India at 16.3%. Okay, that according to the according to the GHI, 30.7% of India's population suffers from undernourishment. 35.35% of children under the age of 5 are standard. 18.7% experience child wasting, and 2.9% of the children do not reach their fifth birthday. Okay. About the Global Hunger Index, the Global Hunger Index is a tool to comprehensively measuring and tracking hunger at the global, regional, and national levels. GHI scores are based on the values of four component indicators: undernourishment, the share of the population with insufficient caloric intake; child wasting, and the share of children under the age of 5 years who have low weight of their height, reflecting acute undernutrition; child stunting, who share of children under the age 5 who have low height of their age, reflecting chronic undernutrition; child mortality, share of children who die before their fifth birthday, poverty, reflecting the fatal mix of inadequate nutrition and unhealthy environments. Key issues of the GHI methodology: 3 out of 4 indicators used for calculations of index are related to health of children and cannot be representative of entire population. Child stunting, wasting, and under 5 mortality are outcomes of complex interactions of various other factors like drinking water, sanitation, genetics, environment, and utilization food intake apart from hunger. Okay, 40 indicator studies challenge use of stunting as an indicator of undernutrition, showing it occurs in well nourished populations as well. Outdated data set: source of data used to construct the global hunger index is outdated and far from convincing. For example, the National Family Health Survey (NFHS) data on stunting or wasting is under 5 years. Our children are not available annually but every 80 to 20 years. Small sample size. The indicator of proportion of the undernourished POU population is based on an opinion poll conducted on every a small sample size. The report reports lower India rank based on estimate of the POU population for India is 16.3%. Of the factors behind hunger crisis conflict: almost 70% of the 309 million people facing acute hunger are in fragile or conflict countries. Violence and instability in Middle East, and Central and West Africa, as well as in the Caribbean, Southeast Asia, and Eastern Europe are particularly concerning. Conflict disrupts food production, forces people from their homes and a source of income, and other injustice mandate access to people in most cases. Okay, climate crisis is one of the leading causes to steep rise in global hunger. Climate shocks are example: drought destroy lives, crops and livelihoods, and undermine people's ability to feed themselves. Like a poor economy, sluggish global growth, and economic stresses linked to slow pandemic recovery and fallout from the war could continue to affect low and middle income countries. These limits investment in social protection programs at a time when food prices remain its crisis level. Like a displacement possibly displaced people face specific vulnerabilities in relation to food insecurity, including limited access to employment, livelihoods of food and shelter, and reliance on dwindling humanitarian assistance. Example: the food area incident. Factors behind the prevalence of malnutrition in the urban as it reshapes food systems, diets, and lifestyles. It increases access to cheap, ultra-processed foods and beverages, promotes sedentary behaviors. According to the Euromonitor International 2019, sales of processed foods in India almost doubled between 2012 and 2018. Undernourished mothers: most Indian women are anemic, and poor women and undernourished mothers give birth to the undernourished babies. The prevalence of anemia, according to the National Family Health Survey 5, is 57.0 and percent in women. Okay, 15 to 49 is 59.1% in adolescent girls. Okay, 52.2% in pregnant women. Low education level and social economic status. Children born to mothers with no schooling and children the lowest wealth quintile are most likely to be undernourished. Vulnerable sections: children from other backward classes. Obesity have highest minimum dietary diversity failure, 79%, followed by the scheduled caste 77.2%, and scheduled tribes 76%. Initiative text from tracking hunger in India. Pradhan Mantri Garib Kalyan Anna Yojana (PMGKY) launched to provide food grains free of cost. 18 crore Pradhan Mantri Madhur Vandana Yojana. Registered women are provided ₹5,000 on the birth of their first child for wage support and nutritious foods during pregnancy and post-delivery period. A portion Abhiyan National Nutrition Mission aims to achieve improved by key nutrition parameters for children and women. Eat Right movement aims to transform the country's found food system to ensure safe, healthy, and sustainable food. Integrated Child Development Scheme (ICDS) supplementary nutrition is one of the 6 services provided under the ICDS. It is intended primarily to bridge gap between recommended dietary allowance and average dietary intake. National Food Security Act and NFSA. NFSA is an act of Parliament of India intended to provide subsidized food grains to approximately 2/3 of India, that is 1.2 billion. We recognize right to food as a statutory right. Okay, initiatives taken for tracking global hunger. SDG 2 Zero hunger. It aims to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. Food wealth, World Food Program, a food assistance branch of the United Nations established in 1961. Its mission is to combat hunger worldwide by providing food aid, promoting food security, and enhancing nutrition. Zero Hunger is an initiative by the UN Secretary General that invites countries to work towards a future where everyone has access to the adequate nutrition. Okay, Rome Declarations on Nutrition. Declaration commits countries to eradicate hunger and to prevent all forms of malnutrition worldwide, particularly undernutrition in children, anemia in women and children, among other micronutrient deficiencies. Okay, Food and Agriculture Organization of the United Nations (FAO) aims to ensure people have regular access to ensure high quality food. Okay, conclusion: policy recommendations made the document include strengthen accountability, international law, and enforceability of the rights to adequate food, promoting gender transformative approaches to food systems and climate policies and programs, and making investments that integrate and promote gender, climate, and food justice. National food health accounts estimates. Okay, next why the news recently the Union Minister of Health and Family Welfare MOHFW released a national health account NHA estimates for the year 2021 and 2022. Okay, about national health accounts estimates. NHA estimates are released by MOHFW since 2013-2014. Okay, NHA for India was envisaged in National Health Policy 2002. The NHA offers detailed description for the financial flows within India's health system, illustrating how funds are collected from various sources, how they are spent across healthcare sectors, how healthcare services are utilized. NHA estimates are derived within the framework of National Health Accounts Guidelines for India 2016 and prepared by using a system for health accounts 2011. National Health Accounts technical NHADS. Okay, prepared the NHA estimates with constant guidance and support from the NHA steering committee and NHA expert group of India. Okay, system of health accounts SHA 2011 is a global standard framework to producing health accounts and facilitate a comparison of estimates across countries. Okay, it provides a standard for classifying health expenditures according to the three axes of consumption. Okay, professions and financing. Okay, it is a result of a joint cooperation among organizations for economic cooperation and development, OECD, World Health Organization, and Eurostat. Okay, key findings of the energy estimates for India: health indicator, total health index, expenditure THA as percentage GDP and per capita trend in 2011, 2022, since 2017-18. Like the THA as percent of GDP increased to 3.83% from 3.31%. The per capita increased to rupees 6,602 crores from rupees 4,290. So detailed the DHE Institute considers current and capital expenditure incurred by the government and private sources, including external funds. So this are DHE as a percentage of GDP initiated indicates health spending relative to country's economic development. DHE per capita indicates health expenditure per person in the country. Okay, government health expenditure DHE as percent of the increase to 48% from 40.8%. DHE constitutes spending under all schemes funded and managed by the Union State and local governments, including quasi-government organizations and donors, engaged funds and channeled through government organizations. Okay. Current health expenditure CHE as percent of the DHE decreased to 87.3% from 88.5%. CHE constitutes only recurrent expenditures for healthcare purposes and all capital expenditures. CHE as percent of DHE indicate operational expenditures on healthcare that impact health outcomes of populations in that particular year. Okay, out-of-pocket expenditures on healthcare OOP as percent of the DHE decreased to 48.8% from 64.2%. OOP are expenditures directly made by households at the point of receiving healthcare. Okay, this indicates extra financial protection available for households towards healthcare payments. Okay, social security expenditures on the health as percent of the DHE decreased to 8.7% from 9%. SSE includes government-funded health insurance schemes, PMJAY, RSBY, etc., social health insurance programs, and medical reimbursements to government employees for healthcare purposes and social health insurance scheme expenditures. Okay, private health insurance expenditure PHIE as percent of the DHI increased to 7.4% from 5.8%. The BHI considers spending through health insurance companies. External donor funding for health as percent of the DHI increased to 1.1% from 0.5%. It constitutes all funding available to the country by assistance from donors. Conclusion: donor healthcare reforms will pave the way for a healthier, more equitable future for all citizens. Increasing healthcare pursuing plays a crucial role in strengthening healthcare infrastructure, expanding testing and treatment facilities, and plays a critical role in addressing pandemics like COVID-19 in the future. Okay, digital health. Why in the news? Ashwin Bharat Digital Mission IBDM launched in 2021 marks 3 years towards enabling digital health. Ashwin Bharat Digital Mission ABDM aims to connect the digital health solutions of hospitals across the country. ABDM is a digital ecosystem. It will also enable a host of other facilities like digital consultation, consent of patients, etc. Key results inclusivity, free of cost registration operating out of the ABDM ecosystem as per one's will, like a single source of truth with no other parallel copies of one's medical records. Federated structure to ensure privacy. Voluntary participation. Implementing agency, the National Health Authority and tracking office of the Indian Ministry of Health and Family Welfare. Commanders of ABDM health architecture. Ayushman Bharat Health Account ABHA ID, unique code digit number to store and manage health records. Healthcare professionals registry HPR, a unified repository of healthcare professionals across all medicine. Health facility facilities. SFR, Ministry of Health Facilities, the National Board of Public and Private Health Information Exchange and Consent as HIECM to ensure that data exchange is driven by the informed consent. Okay, Unified Health, the Health Interface UHI to facilitate the discovery and delivery of health services. Okay, National Health Claims Exchange (NCX) to standardize the insurance payment ecosystem. About digital health, the WHO defines digital health as a field of knowledge and practice associated with the development and use of digital technologies to use improve health. It includes digital health application called electronic health records, telemedicine, wearables devices to monitor wealth aspects and health information systems for managing, okay, storing and exchanging health information. Digital health technologies, okay, AI and big data to quickly identify patterns in tremendous volumes of data. Internet of medical things, interconnected medical devices, augmented reality to make medical procedures more efficient, digital genomics, etc. Okay, next we have the significance of promoting digital health. Seamless medical record sharing enables Indians to use ID and tools to share prescriptions, blood tests, reports, and X-ray diagnostics with the doctors. Unique personalized medical account creates a unique health ID for every citizen. Digital registry to facilitate seamless interactions between the healthcare experts. Chronic disease management helps manage chronic diseases which have become a critical public health challenge in the past 15 years. Okay, also improve public health monitoring and advance evidence-based policy making the long run. Enhance the treatment for critically ill patients. Canada portability for expedite, okay, treatment of critically ill patients, especially those suffering from multiple ailments. A comprehensive medical history creates a repository alerting doctors to patients medical history with one click, important for training patients. Training patients with a highlighted, okay, suffering enhanced treatment for critically ill patients. Canada portability for expedite treatment of critically ill patients, especially those suffering from multiple ailments. Okay, common medical history repository alerts and doctors to patients medical history with one click, important for treating patients with comorbidities are highlighted during common. It also gives patients options to choose which records they want to share with the healthcare providers. This also will ensure all medical records as not lost as every record will be closed digital. Okay, concerns pertaining to digital health, privacy and security issues. Unauthorized data access and breaches can compromise patient privacy and lead to identify theft. Okay, example, personalized data collected can be explored by insurance companies and pharmaceutical firms for targeted advertisement. Okay, algorithmic bias technologies such as AI and can result in unfair or discriminatory treatment. Example might lead to racial and ethnic disparity in healthcare equity and access issues. Okay, unequal access to health issues, digital health technology and digital literacy skills can explode one of our operations. Okay, example, poor internet connectivity in rural areas can make a data entry and utilization of digital healthcare services challenge. Okay, next we have the what benefit for citizen registering an ABDM. Okay, paperless health records accessible anytime anywhere. Citizens will be able to access healthcare digitally through teleconsultations using apps integrated with the ABDM. ABDM achievements digital health IDs and records. ABDM has generated 6.7 crore Ayushman Bharat health accounts. Abha and linked 42 crores health records. Healthcare facility integration. The initiative has integrated 1.3 lakh healthcare facilities to 70,000 private centers. Private sector participation more than 236 private entities comprising laboratories, pharmacies, and digital solution companies have joined the ABDM ecosystem. ABDM key initiatives: QR-based outpatient department OPD, it reduces waiting time, enhancing efficiency and accuracy. Digital health and incentive scheme DHIS. Okay, financial incentives up to 4 crores to boost digital health adoption widely. Microsites for private sector adoption that is aimed at addressing silence in ABDM adoption. Okay, next we have the lack of trust in digital healthcare system. Example, the failure of the UK's National Health Service digital ecosystems highlights the importance of learning the trust of healthcare providers, lack of standardization in digital cards. India struggles to standardize coverage and quality of existing digital cards. Example, one nation, one ration card, PMJ code, author code, etc., leading to data migration and transfer issues, as well as concerns over data security, communication challenges in diverse healthcare ecosystem due to its linguistic and cultural diversity in India. Way forward, enhance universal reach can ensure the intelligent health solution is elevated across diverse user base, including displaced populations and diverse racial, cultural, and backgrounds to improve quality of life and collaborative decision making, strengthening technical proficiency, improve digital skills among medical teachers and students to better leverage digital health tools, enhance target solutions, create customized and individualized approaches to digital health tools supported by empirical evidence, build ethical oversight. A formal governance body can be established to develop a framework for data collection, sharing, and usage of draft of Code of Ethics. News in short, UN Women released World Survey on the role of women in the development report. Okay, the theme of the resort is harnessing social protection of gender equality, resilience, and transformation. It took stock of progress, okay, gaps, and challenges in building comprehensive gender responsive social protection system. Need for gender responsive social protection. GRSP, gender responsive approaches for social protection, actively seek to respond to gender specific risks, okay, vulnerabilities, and constraints such as women's access to resources, disproportionate responsibility for unpaid care, domestic work, gender based violence, lack of violence in decision making. Okay, GSRP approaches acknowledges the nature and intensity of risk and constraint based on gender. Okay, key findings of the report: 2 billion women and girls lack access to any form of social protection. Such as cash benefits, unemployment, insurance, pensions of healthcare cover. 60% of women globally still give birth without access to maternity benefits. Like gender-specific risk and vulnerabilities are exacerbated by factors like conflict, climate change, and economic shocks. Key recommendation addresses gender gaps and biases in existing social protection systems, policies, and programs, improves coordination with the gender-responsive employment policies and public services, enhance social protection policies and programs to meet the needs of women and girls during a sudden and protracted crisis. Takes a right-based approach to social protection delivery. Okay, initiative taken by India for Women for Social Protection, Manrega, Pradhan Mantri Madhur Yojana, and Pradhan Mantri Ujjwala Yojana, LPG households, LPG connections to BPL households.